So you've done PT, you've done the dilators, you've done all of the advice, but sex is still hurting. Why is that? That's because no one has told you how to teach your body how to feel safe during intimacy. And that's what we're going to talk about in today's video. If you don't know me, my name is Kana Kassard. I'm a sex therapist and also a pelvic health mental coach. And I've been through vaginismus treatment myself, so I know how frustrating it is. That's exactly why I created the approach that I do to help clients not feel so frustrated and alone in the process. So let's dive in. So if you're watching this video, I'm assuming that you're feeling stuck, just like everyone else that I work with, because they've tried the PT, they've tried the mindfulness, they've tried the dilators, maybe they've even gone to couples therapy and nothing works, and then they feel really alone and frustrated and kind of in a hopeless spiral because they're not sure where to go after all of the recommendations. And that's really frustrating because nobody teaches this like one key piece. So those things can really help with muscle retraining, relaxation, blood flow, like all of the things. You can do all the things right. And the challenge is that if there isn't a way for the body to be retrained in a very specific way, then it's going to be hard for those things to stick around and help you move into applying those skills and tools in intimacy. This is the thing that most people miss, is because vaginismus is not just a muscle relaxation or a muscle response. It's an overall whole body nervous system response. It's got attachments to sex and shame and partner relationships and guilt and disappointment and negative sex messages. Like there's so much that it's not just about let's retrain this one singular muscle detached from the entire system of who you are and what you've been through. It's not about just healing the muscle and helping the muscle get retrained. It's about how your body feels safe during intimacy or when your partner approaches for intimacy or when your body has some kind of arousal. Your nervous system has detected that there's a lot of other things than just your muscles needing to be relaxed. So it's kind of been sensing for danger this whole time that you've been dealing with these challenges and relational conflict, and maybe your life has been held up because you don't want to date, you're worried about the sex talk, you don't get to have kids because you don't get to do the sex thing that you want to do with your partner in order to have all of these experiences that are so important. Your body hasn't learned how to make that transition. It's kind of like training for a marathon on a treadmill only and not bringing into consideration all of the outside factors and runners, running in your way and like needing to be able to grab water from somebody else when you're trying to move. Trying to do the practices in a clinical setting can get you only so far. Trying to apply that into game time is going to be much more challenging. This is especially important when there are things that you have to consider that are actually outside of your control. So with PT, dilators, breathing exercises, all of those things are mostly within your control. When your partner comes into it, you might not know exactly where your partner's hand is going or how fast they move or when they even move. And so trying to bring your body into a space where suddenly there are a lot of factors that you can't control, then your brain and your nervous system is going to start to feel a little bit like it needs to be on high alert. One of my clients actually said that they had seen 3 different specialists, wondering why the PT or the dilators weren't working. They were still having pain during intercourse. And it wasn't until I taught them how to integrate the nervous system regulation tools that I'm talking about and also learn and understand how to use this during intimacy, did they finally find relief and feel a lot better about the kind of sex and the kind of possibilities that they were having with their partner. So let's figure out how to teach your nervous system to translate from a clinical setting into a more intimate setting where you might not be able to control all the different factors. So this means taking the tools that you have and not only using them in neutral settings, but also in what I call like high pressure settings. And maybe this is not a pressure from your partner, but maybe it's just you now know, okay, this is the thing that I've been working toward, and now we're going to do it, and I don't have control over all the different elements of this. So let me give you a somatic experience of what might be happening in your nervous system. I want to invite you to close your eyes or take a soft gaze, whatever works for you right now. And take a breath, let your body kind of settle. And now I'd like to invite you to bring to your mind, maybe like experiencing your dilators at home, doing the exercises there. Just imagine that as if it's like a movie playing on the back of your eyelids. And as you do that, as you remember a moment in which you did this, notice what sensations come up in your body. Do you have any muscle tension? Does your heart rate increase or decrease? Do you have any racing thoughts? Maybe even check in with what's going on with your pelvic floor if you notice that. And now I'd like to invite you to think about engaging with your partner intimately. So it's kind of the first time that you're trying again to see if this might feel different. They're approaching you, you see them initiating, or you initiate with them, and you know that you're going to have some kind of attempt at penetration or penetration. You're really not sure how it's going to go. What do you notice happening in your body now? Is there more muscle tension? Do you feel more like your heart is racing? Does it feel harder to breathe as deeply? Is your pelvic floor maybe really contracting? Just what do you notice? Does it feel worse or more unpleasant? And if not, then great. If you don't notice anything, we'll talk about that in a moment. But now we're going to give yourself a nervous system rinse. So I'd like to invite you to give your body a shake, stretch, whatever feels right for you to kind of reground yourself to this present moment where you're safe, your partner's not approaching intimacy, and just notice maybe what it feels like to feel seated here watching this video, knowing that you're going to get some tools that are going to help you. And just notice the change that happens in your nervous system. Does it shift a little bit? Does it feel a little bit more relaxed? And if not, that's okay too. So if you noticed that your muscles or your body responded more unpleasantly when you were thinking about going into intimacy, then that might be an indicator that your nervous system needs to learn how to apply the skills you've already learned into an intimate moment. So a lot of times people will think, I just need to stretch and relax and breathe before an intimate experience, and then I should be fine. But that might not be enough because the nervous system, it only gets a little bit of a drop of relaxation, and that's great, that's awesome. I don't want to dissuade you from doing those things. But if you find that you're still having pain during intercourse, even after doing all of those things, it's possible that your body hasn't learned to apply the skills into intimacy. And so that's what's going to be super crucial for what your next steps are. Now, I mentioned in the somatic experience that if you didn't feel connected to your body at all, if you didn't notice sensations at all, that might really indicate that some kind of somatic interventions or somatic mental health education or somatic therapy will be really, really crucial to your process of overcoming pain, but also having more fulfilled, more satisfying sexual experiences. So if you want to understand how to start soothing the pain response, I created a free 4-day course that will give you the techniques, the overview, so that you can actually start putting it into action immediately. You can get access to that course in the link below, or you can go to kanakassar.com/soothing pain. If this is a challenge for you, don't worry. This is why I make these videos, is to help you learn and understand that your body's not broken, you're not broken, your relationship's not broken. We can work through this. You just need a full body approach that addresses both the mind-body and the mind-body connection to help you overcome pain and set the pathway for arousal and apply all of that to intimate moments or to moments in dating, to kind of anything related to any kind of sex that you want to be having. In the next video, we're going to talk about a huge misconception that having a loving, supporting, caring, patient partner should make sex feel safe and pain-free. And this just really grabs all of my clients because they feel like, my partner's great and amazing. Why can't sex feel good with them even after I've done all of this other work? So there's an answer for that. Go ahead and watch the next video so you can understand why your brain doesn't care how wonderful and caring your partner is.